Great. Good afternoon, everyone, and welcome to Emerging Issues in Harm Reduction, Family and Community Work, a three-part webinar series as part of a unique partnership offering continuing education opportunities to train social workers in the practice of harm reduction. My name is Jen Tracy, and I'm the Chief Program Officer at the RIZE Massachusetts Foundation, and I'm also a fellow social worker, I'm happy to say. RIZE is proud to be part of this groundbreaking partnership with the National Harm Reduction Coalition and the National Association of Social Workers, Massachusetts chapter, to expand knowledge and create space for dialogue about harm reduction and social work to advance practice and deepen relationships with clients. We are so pleased to welcome you for the first in a three-part series focused on family and community work in the practice of harm reduction. This series builds on our past webinars on themes such as cultural humility in harm reduction and the impact of stigma on substance use treatment. We are so excited to have over 800 people registered for this series. As some of you may be joining us for the first time today, I'm happy to share some brief background about RIZE. Launched in 2017, we are the only public-private partnership solely dedicated to funding and creating solutions to end the overdose crisis. Our goal is to ensure that people experiencing substance use disorder have access to care and experience better quality of life and overall health. Guided by those with lived and living experience and unafraid of new ideas, RIZE is building networks, creating programming, and supporting community partners who are using novel approaches to preventing overdose. One of our strategies to end the overdose crisis is building inclusive networks to share lessons in exploring and enabling change. This is what we hope to accomplish during this series as the crisis continues to take its devastating toll. Strategic workforce investments like this ensure that professionals in the care continuum, like social workers, have the critical tools you need to directly support your clients experiencing opioid use disorder. Harm reduction offers a set of practical strategies and ideas aimed at meeting people where they are to reduce the negative consequences associated with drug use. Social workers are uniquely positioned to integrate those practices to improve client well-being. Once again, we are very proud to be partnering with the National Harm Reduction Coalition and the National Association of Social Workers, Massachusetts chapter, to bring the third webinar series of this partnership to you. Before we get started, we want to share just a few housekeeping items. This webinar, as you know, will run from 12 to 1:30. Participants will be muted throughout the full webinar, or please mute yourself, as Chris Belli just said, but please feel free to add your questions and comments in the chat. We'll also reserve the last 10 or 15 minutes for a question and answering session. Please make sure your full name is displayed on your Zoom. And importantly, there will also be a code given at the end of the webinar. All participants must enter this code in a course evaluation form to receive credit. You can find the link to the form in the email you received this morning. Thank you all in advance for taking the time to share your feedback. The slides from today's webinar will also be shared with you after you complete the evaluation form. Please note that this webinar is being recorded and will be posted on the National Association of Social Work's online Community Education Institute, as well as RIZE's YouTube channel, where you will also find the recordings from our previous webinars. For this series will once again be led by our amazing partners, Tanagra Melgarajeo Pulido from the National Harm Reduction Coalition and Joe Pereira of Outlook Associates of New England. With that, I'll turn it over now to Joe and Tanagra, and I hope to see you all back here next week for the second session in the series. Thank you so much. Joe, Tanagra?
Thank you, Jen. Buenas tardes, good afternoon, everyone. My name is Tanagra Melgarejo Pulido, and I am part of the National Harm Reduction Coalition. I'm gonna let my fellow partner in this venture today introduce himself.
Thank you, Tanagra. Joe Pereira. I am in private practice in Arlington, Massachusetts, focusing on a number of issues, including chemical addictions, and very happy to be part of the team with Tanagra to present this information.
Thank you, Joe. And today we will start the first of 3 webinars that will address different emerging topics in harm reduction, as they also are connected to our practice as social workers. And today's webinar focuses on how do we support families and loved ones of folks that have that live with that are using substances or are engaging in substance use. I'm part of the National Harm Reduction Coalition. I invite you to visit our website to search for publications and resources. We have a ton of great materials there that we love for people to take, download and use. If you're interested in any information that we mentioned here, you can talk to me. I'm sure you can also reach out to Joe. You'll have our emails. We can connect you with those documents. If you're looking for something and you can find it, reach out to me. I am be happy to share that information with you. If it's in our website, I'll make sure that you can get it. And then I'll pass it to Joe, who's gonna walk us through our table of contents.
Yes. So, and actually, before I do that, I just kind of I came across a few months ago some statistics that this organization called KFF, which is a health policy research group, did a survey of 1,300 adults in July 2023. And of that survey, 51% worry that someone in their family will experience a substance use disorder. More than a quarter of respondents who had a relative with alcohol or other drug use disorder say their mental health was significantly impacted by their family members and dealing with their family member. And nearly 1/3 were concerned that someone in their family would overdose on opioids. So I think the relevance of this topic, hopefully, just from that survey, just points it out. So what we'll be doing is just kind of a overview of harm reduction, and then harm reduction communication, kind of just some a general sort of guidelines, and then also barriers when communicating with people who use drugs, some tools for practice around active listening, and then nonviolence communication, and then boundaries and the importance of those in working with people. And then we are going to have a guest speaker talking about her own experience in her family around dealing with family members with substance use issues. And then, as mentioned, we will be leaving some time at the end of the presentation for some questions. Also, there will be a couple of questions that we're going to throw open to all the participants. And just if you could respond in the chat room, that would be helpful.
So today is an invitation, as we kind of like ground ourselves in this space, to be grounded in this moment. It's an invitation for us to be open to shifting our perspective. It's also an invitation for us to being open to not being the expert or knowing everything. We're also asking or inviting us all to lean into our discomfort and see it as an opportunity to explore and go deeper. And finally, we're inviting you to be committed to praxis, which is the intersection of reflection and action, particularly when we're dealing or addressing substance use. We know there's a lot of stigma, and that's a huge barrier for the people who experience substances as well, substance use, as well as families and loved ones of those folks. And so the more that we can be open to challenging ourselves and what we hold as things that we know, and open ourselves to changing perspective, the more that we can support those folks as well. And I just want to sort of move us through quickly some level setting information around what harm reduction is, because we can't assume that in ways. So for the purposes of this session, we want to acknowledge that harm reduction has foundational elements that are key to this work and to this movement. And the key foundational elements of harm reduction are involving participants, the folks that are impacted, centering their voices, trusting their expertise, trusting that they know what is best for them, And this also includes the families and the loved ones. Any positive change as defined by the person, that will look different based on different persons, right? We're all different, we're unique human beings. So what that person understands as positive in a regard and believe it. Respecting people's autonomy. The idea of choice for people is so important, particularly when we don't have many opportunities to exercise choice and exercise autonomy. And finally, the practice of radical neutrality and acceptance, which is a key tenet that I have found has helped me to really rethink and reconsider my practice when I work with other folks. And so we'll go over those two concepts really briefly. So personal autonomy is key to the practice of harm reduction. And we understand personal autonomy to be a person's capacity for self-determination and self-governance. As clinicians, it is important for us to remind family members and loved ones of people who use drugs that it's key, it's vital that we respect the choices of the people that we're in relationship with. We want to let those family members know and loved ones that it may not be the choice that they would make, but it is essential that we respect the choices of that human being as their right. And also for us to recognize that most often than not, we're doing the best that we can with the tools that we have and resources we have. We don't know what we don't know, right? So if these things have worked for me up till this point, it is important to understand that there's something there for that person, and shaming them for substance use is not going to make them better. It's not going to set them up for success. It's not going to minimize harm. In fact, it's going to augment it. It's going to make it worse. And then another piece that is important for the practice of harm reduction, and this is a concept that has been developed by Pat Denning and Jeannie Little. So if you're not familiar with Pat and Jeannie's work, we invite you to do two things: to come to come to all of the trainings that we're offering, in this series. But if you can only make two, please make the third one. We were going to have there someone who works for the Harm Reduction Therapy Center, has been trained by Pat and Jeannie. Pat and Jeannie are the original psychotherapists that decided to include harm reduction and make their therapy harm reduction based. And it is amazing the cumulative amount of work that they have produced and theory that they have produced around this. They have several books. And so we're borrowing this term from them. And when we're thinking about harm reduction, what has been helpful for me is to try to work from a place of practicing this radical neutrality, which means that I recognize that I'm going to be grappling constantly with ethical gray areas. And it is an invitation to me as a practitioner to tolerate, to accept, and to try to understand behaviors that may be difficult, challenging, different, behaviors that not be behaviors that I engage in. And that means that I have to be open to be taught by those loved ones, by those folks who use drugs. And ultimately, it's asking me and other practitioners to do something that is really hard when we think we're experts, which is to relinquish that role of authority of judge or expert, because ultimately I am an expert in my own life, and that person in front of me is an expert on their own life. And what I want to do is to partner with them. I want to learn from them. I want to be able to support them, and I want to be able to provide a space for that person to feel safer and healthier. And this is Jujo.
Yes. So what we'd like now is if people can just put in the chat an answer to this question that people will have different reasons for using drugs. What could be some of those reasons? Coping, trauma, childhood trauma, stress, coping skills, escape, trauma, pain, coping and escape, depression and despair, numbing, abuse, avoidance, entertainment, serious medical issues, biological, genetic vulnerability, undiagnosed disorder, self-medication, pain, homelessness, excitement, pain, mental health. Yeah, so we're getting sort of some themes here. And grief, yes, medical use of pain meds, pain, self-medication, coping, peer pressure, numbing. Yeah, so those are all really reasons. And so this actually, when we think about having family members work or working with family members who may have somebody in their family with a substance use disorder, it's asking them to be curious and asking them to sort of be curious about why their loved one might be using substances. And so that is an important part of, so as we think about that, it's helpful to assist family and friends in creating a supportive and constructive environment where they can explore the dynamics and impact of substance abuse in their relationship. And obviously, it obviously goes without saying, how we communicate is key in fostering or hindering the process of when this occurs.
So what is communication and why is it important, right? Particularly when we're trying to connect and engage and support folks who use drugs, support their families and loved ones, right? So communication is a tool that we have that allows us to be able to be in relationship with each other, to make sense of the world, to make sense of the people who are around us, right? Communication is not only words. We're going to see in a minute that communication involves our whole body and our mind and our spirit, right? And it is important because without communication, what would the world be, right? What would we be in relationship to one another? Communication is a way, it's a tool that we have to help us build bridges, right? To be able to see each other and to be in community. So we also know, and we know that, we live in a white supremacist world, right? In a capitalist world, in a world where communication won't be neutral and it's not neutral. It is influenced and it is impacted by the intersection of our identities and the identities of those that are in communication, including the social recognition or positioning and power they hold and receive, right? And we can see this where I've been in situations where I've had a fellow female colleague share an idea or give her insight, and that's passed over, right? And a male colleague raises their hand and says exactly the same thing, and then somehow that becomes important and becomes relevant, right? So this acknowledgement that communication is not neutral, particularly when we're talking about folks that use substances and we think about the role of stigma and shame, right? And the humanization that that person experiences. Many times when we're communicating and the language that we're using can, instead of helping, hinder the ability to build those relationships. And a little bit, we're going to be talking about person first language and the importance of that when we're helping to build healthier relationships with those folks that surround us that are also folks that use drugs. I think this is you, Joe.
Yes. So so about 50 years ago or so, social psychologists looked at what people pay attention to in face-to-face communication. And they were able to break it down. And so one of my other areas that I work with people is around anger control issues. And so I do a piece on communication, and I use this slide, or I use this kind of this material to get people to really understand that it's often how they communicate, not just what they communicate. So it's pretty I think when I share this with people, it kind of is remarkable, although I think people get that body language and tone of voice are more important than the content and the words that people use. So I think that this is really important. And one of the things I tell people is, if they don't believe this, or they wonder about it, is just watch a TV series and mute the audio volume and just watch the show. And while they may not be able to get everything from the show, they can probably get a good sense of what's going on. Now, what I would also say here, and I am given my age, and I am very old school about communication, but the role that texting plays in sort of significant conversation. But just remember, if people are communicating in that way, email or texting, you're losing body language and tone of voice. Even though we have emojis, they really do not convey sometimes the full extent of what people are communicating. So I often advise people, if they are needing to have a serious conversation with their significant other, family member, friend, it's really best done at the very least by phone, if not face to face. So here's another question for the audience. What are some specific specific barriers to communicating effectively with our loved ones who use drugs? Or if you're working with clients who maybe have family members, what do they find most challenging about communication with those loved ones? Defensive, judgment, intent versus impact, anger, fear, anger, denial, lack of understanding, misunderstanding, starting the conversation, mistrust, process of relapse, not wanting to be judged, lying, right? May feel judged. Anything else? Invalidating, yes. Attention elsewhere. Feelings of anger, yes. Judgment, feelings of inferiority, denial, stigma, shame, not ready to change, yes. And that could go for both the family member and the person who may be using drugs. So dismissing, great, yep, all of those. Avoidance, great.
Yeah. Yeah, and as we can see, you know, there are some main barriers in communication, and many of the ones that you have mentioned fall into some of these buckets, right? And when we think about communicating specifically about substance use with people that we love, that we're in relationship with, there is emotional barriers that you mentioned that come into play, right? Our own fear, our own uncomfortability, the person's fear, their uncomfortability, right? The sense of defensiveness that comes up. The language that we use can be really challenging too, particularly if the person is feeling attacked because of their use. And then there's issues that are cultural around substance use, right? That we may not understand. And that creates then a division. It creates a distance, right? Because I don't understand what's behind that person's use. I'm judging the use and I'm not understanding the reasons behind it. All I can see is the harm, and I'm not taking into account that there's a reason why this person is using, and there's a benefit that this person is drawing from their use. This is doing something for them and it's working. And many times that becomes a challenge because the person then feels misunderstood at folks' sets. And then we avoid the conversation because we may not know or understand why this person is doing this thing that we're seeing or thinking about in our heads as something that is harmful to them. We cannot understand why is it that you stay? Why is it that you keep doing these things that are, making our relationship more difficult, right?
So I think stigma is really, and we've kind of addressed this across all of our trainings, how important that is. So thinking about this not only for the people who are using drugs and the stigma that they face, but also for family members and other loved ones who also feel their sense of stigma, perhaps being embarrassed about talking about it with other family and friends. And so it's really key to kind of understanding the impact of stigma, the attitudes people have, the stereotypes that get developed, and then the actual discrimination. And so when we think about stigma, Tanagra, the next slide, please. So stigma is the belief and discrimination is the action.
And stigma, it's really pernicious, it's really harmful. It's when you ask folks who use drugs what are one of the biggest harms, the stigma keeps coming up again and again and again, and it plays out in every area, every realm of someone's life, from fear of getting help to loss of job or home, to isolation, to loss of relationships, to feeling lonely, to feeling shame and feeling discouraged, right? And this is a cycle that perpetuates itself, that impacts a person's ability to connect to others, to feel deserving of support, to even feel that they can share who they are truly, because they're not going to be believed, because they are already labeled as liars, as people who are not to be trusted, who are not worthy, who are less than. And that can be a huge, huge barrier for the person and for those of us that are in relationship with them, because there is stigma, as Joe mentioned, stigma through association, who also, it's another barrier that family and loved ones of people who use drugs encounter in terms of like acknowledging and sharing with others that they need support in order to be able to be better present for their loved one who uses substances. And then the other piece here that it's really, really important that I cannot help but emphasize, and if you take anything away from this, the part that Joe and I are sharing with you, is the power of words. You know, we want to use person first language, and we encourage folks to use person's first language because we forget that we're working with people. Stigma dehumanizes people, and what we want to do is center again the person, center that we have in front of us a human being, that we're not viewing them as a disease or as a disorder, as a condition. They are a whole person. They're not only their behaviors, they're more than that. And the more that we can bring families and loved ones back into this space of using person first language, it also opens the door, right, for better communication and better relationship building with the person that they love that is using substances.
And so what I would say, and through based on what Tanagra is again, when we think about working with family members, is to really help them do the person first language. And just to give you a quick, I have been working with a client whose both his mother and stepfather had a serious alcohol use disorder. Growing up, faced a fair amount of physical and emotional abuse, and he was alienated, particularly his mother, and he would keep on calling her a drunk. She's a drunk, she's a drunk. She was actively, and so at one point we had a discussion of staying. Not only did it just feed his anger and resentment, but it dehumanized her in some way. And so really using that opportunity, and there's this notion of you don't want to call people out, you want to call them in. And so having that discussion around how using person first language, I think, can be really useful. And again, thinking about this as you work with family members and loved ones.
Yeah. Also, Joe, I wanted to add, in terms of the words that we use as well. I'm in San Antonio actually for the Neonatal Abstinence Syndrome Symposium. And there was a presentation earlier this morning by a keynote speaker, and he was sharing a study that was carried out with medical providers that work with families of parents of babies that have been born with NAUS, which is neonatal abstinence syndrome. And so one of the things that they said, what he was explaining, was that this study was basically a case study that only shifted two terms. One group was giving a case study with that said substance abuser, and another was substance use disorder. And the huge differences that folks shared in terms of how they would approach treatment for a substance abuser versus a person with substance use disorder was huge. As you can imagine, the persons that had the case study with the substance abuser thought that, stigmatized, shamed, didn't think that the person should be provided with the same amount of or extensive services, right? So it's really thinking about the power of words, because words shaped the way that we view others, right? And we as providers are not immune to that. We make sense through words, and we see people through the words that we use to name them.
So what we wanted to now touch upon is tools for practice, sort of this notion of active listening. And so I'm not gonna, I think I think most of us are either therapist or therapist inclined, therapeutically inclined. So I'm not going to go into a lot of details. I would just, and again, thinking about this in the context of working with family members or loved ones, 3 or 4 of these just to kind of highlight: ask questions, ask questions, ask questions. And so getting a family member to take that empathic curiosity towards their loved one, not easy. And so that's obviously important to acknowledge. Avoid judgment, because that will almost guarantee an increase in defensiveness by the person who is using drugs. So really to emphasize that. Don't give advice too quickly. Again, I think understandably parents, loved ones think or believe they know what's best for their loved one, and so they want to give advice very quickly, and that gets into the I oftentimes educate my family members around the stages of change, and then the other piece is listening may be enough, and really kind of encouraging family members not to downplay the importance of listening.
Thank you, Joe. And also sharing with families and loved ones of people who use drugs, what could be some of the blocks to active listening that they may be experiencing so that they can recognize them, right? From comparing to rehearsing to filtering, right? Which is hearing what we want to hear and avoid hearing the rest of the stuff that doesn't make sense to us, to judging, as Joe said, identifying, sort of like taking something from that person that is they're sharing with us that makes them really vulnerable, and then sort of referring back and making it about us, which makes the person feel unseen and unheard, and advising, right? And I think we're all in helping professions, and we and when it's harder when you are in relationship with someone who you know, is using substances, right? Because we want to support them, we want to help them, right? And so that piece of advising, trying to provide solutions that we haven't been asked for, that are shared in a non-consensual way, as Joe said, can, instead of helping us build trust, can do the opposite, right? Can create a lot of barriers for people. And then finally, sparing, you know, this instead of focusing on things that we can agree upon, we're focusing on things that we are disagreeing, or trying to be right as well. And then placating, right? We sometimes feel, oh, we're gonna piss them off, we're gonna make them angry, so we're not bringing up how we really feel. And I think that piece is also important, right? We want our loved one to know, right, that we're there for them, and also we want them to understand the impact that this may be having on us. And that piece of placating and not necessarily naming the things eventually will explode in another way, right? It will come up in a way that it's not necessarily going to help us build solid, healthy relationships with our family member.
And Tanagra, can I just say one other thing? So again, I made reference to it before, is helping loved ones sort of monitor the level of defensiveness, because once defensiveness is there, the conversation gets derailed. And so really being conscious of that. The other thing, I call it the ping pong effect. The yes, no, yes, no, yes, no. And again, that is really not conducive to kind of a productive, honest conversation.
And so now we are going to look at some other tools, including nonviolent communication. And what Joe was saying, once defensiveness sets in, it's really hard to build trust. And so one of the things that we can do is take this practice of trust, which is transparency, relationship, understanding, shared success, and testing assumptions, or telling the truth, right? Or truth telling, right? We want to be transparent with our loved one. We want to be open about what's on our mind, right? That way, we know that we're both in the same page, or we're trying to get to be in the same page, right? We are also sending messages to that person. I'm being transparent with you. I'm being open. I'm sharing all my cards, and I'm putting them in front of you at the table. I am trusting you will not harm me. And then this helps us to build relationships, right? We are letting that person know we're here. We want to build this relationship with you. We appreciate you. We see you. We respect you. If we feel that way, we're able to to trust, valga la redundancia, we're able to feel that we can be in relationship with this other person, which is a key part of communication. In order to communicate, you have to feel that you can trust that person. And then we move to understanding, right? We can figure out where are we both standing, and we can build that understanding together. We're also trying to understand that other person's perspective. We're also trying to come to this as I am curious, as Joe say, asking questions is so important. That caring curiosity of really trying to see what this person is seeing, trying to understand what it means to walk in their shoes. And that leads us to wanting to share success. We are here in relationship with each other because we want to be present for each other as a family member or a loved one of a person who uses substances. I want to ensure that you are successful and that I am supporting you in being successful as well. And the last step of this is testing our assumptions and telling the truth, right? We tell ourselves a lot of stories, right? Particularly when we don't have all the information, or we haven't been able to ask the questions that we need. And sometimes a lot of those stories that we tell ourselves are not necessarily rooted in some truth, but they're not the whole truth. And so we want to together discover what that shared worldview is. And that shared worldview then will become that truth and will allow us to trust. So this exercise can be really helpful as a reminder for us when we're working with loved ones and with family of folks who use drugs, that without trust, we cannot build relationships, and we cannot have then healthy communication that can be conducive, right, to the support that we ultimately want to offer that person.
So,
yes, Joe, go ahead.
No, sorry. So the nonviolent communication, it's people who may be familiar with Marshall Rosenberg. If you aren't, please, he's got a number of books, and he also, he has trained trainers to kind of this model of, and again, with my work with people around anger control and anger management, I teach this model of observing, and observation is without judgment, and being really careful about that. It can be really hard because you can add one word like always or never, and you suddenly make it a judgment. You speak the feeling, and I think that gets to Tanagra's sort of talk about transparency. I think you're being in the moment by expressing the feeling, the need that you have in the moment, and then the request, the concrete actions that you would like taken, and then again, oftentimes in the form of a question: would you be willing to? Understanding, and this is where helping people, those family members and loved ones, they may say, no, I'm not willing to. But again, being sort of aware of how we frame it can be very influential in terms of how a person receives it.
Yeah, I think also, Joe, something that is important here is we do this and we try to manage expectations of family members, because the person can say no. And
Right.
if we go to personal autonomy, and that brings a radical neutrality, right? The person has the right and has they can say no. And what does that mean for us, right? If that person says no in the context of building this relationship, right? Where do we go from there? And how do we get family members, and loved ones to recognize that the person has a right to say no to our request? So then we go back to the drawing board. We continue to have conversations. We explore what's behind that no.
Right. And then again, sort of the best practices to avoid using stigmatizing language. Again, we've kind of touched upon that. And then really what we're talking about are motivational interview methods. I hope all of you, if you've not really to take training in motivational interviewing, I just think it's so important to our work in terms of the approach. Whether you're working with people with substance use disorders or not, it can be really helpful. And so this notion of asking, telling, and listening. So asking permission, again, the open questions, some education it is important, and then listening. And our speaker will be talking about craft, which uses a lot of I think, motivational interviewing principles.
Yeah. Thank you, Joe. And
And
then
then,
we're moving to establishing boundaries. Here you go, Joe. Go for it.
yes, yeah. So this is Tanagra found this great quote. Boundaries are the distance at which I can love you and me simultaneously. And so it's an and also aspect to the work that we're doing. And understanding, I always talk to people that empathy without boundaries is going to cause you trouble. And it's going to lead to likely a lot more anger and burnout and that sort of thing. So we need to have boundaries, and setting limits is a way of protecting ourselves, but also being able to be in a place where we can help others.
Yeah. Thank you, Joe. And boundaries are not meant to be set to punish someone, right? That's not the purpose of boundaries. Boundaries are meant to be set as a way, as Joe said, to both love me and you, right? Boundaries are the most transparent, honest thing that we can offer a person, because we're letting them know, this is where I stand, this is what I feel, this is what I need, and this is what I hope you can offer me, right? These are the things that I'm going to do to take care of myself. And as we know, boundaries are limits that we set, and they can be around several different realms. There's 7 types of boundaries: physical, time, mental, emotional, material, internal, and conversational, right? So really getting folks comfortable with setting boundaries. I think that I would say that my experience has been that we're not taught necessarily to set boundaries from an early age. In my culture, for example, I was told that I had to kiss everybody because it was unpolite to do so, and my body was telling me no. I was told that I had to eat all of my food, and you couldn't leave anything in the plate, because if you left something in the plate, somebody else would be dying of hunger somewhere, but my stomach can't hold anymore. So that's another boundary. I was told that if my parents called me and told me I had to do something, no matter what I was doing, I had to interrupt it. So it was a violation of my time. I didn't have private time or personal time. So we are constantly being gaslit a little bit around boundaries. We're told we need to set them, but then there's all these other things around work and family and everything else that tells us the opposite of that. So having conversations with people and really helping them work through articulating and understanding and even figuring out what their boundaries are as family and loved ones of people who use drugs is super important, because many times that's not a thing that we sit down and think about. I think culturally we live in a society that talks a lot about boundaries, but actually expects us not to have it. And that can be really challenging.
Tanagra, can I actually just what you were talking about? So I I'm a Portuguese Catholic, and my family was really good at the, some of you may be familiar with the Mater complex. So doing things at the expense of ourselves and our own needs and wants. And so kind of learning that that's not in the long run very helpful, and it just creates resentments and anger.
Mm-hmm. Absolutely. And I think, Joe, right, we're going to be wrapping up so we can have Andrea share their knowledge and expertise with us. But thinking about also, I think this is really useful when I work with families and loved ones of people who use drugs. It's a reminder of the things that I can control and the things that I cannot control. I can control myself. Pretty much. And I try. Sometimes it's not so easy some days. Some days it's better than others. But there's all these other things that I cannot control that I'm constantly trying to, in this tense relationship of how do I control people's perceptions of me, or the past, of the future, other people's boundaries, how other people react, how they behave. I think that what we can do is how I show up for people, how I show up, how I engage in relationship building with folks, how I communicate, right? How my body language is present in the space. All of those are things that I can control. And it's a reminder to families and loved ones of people who use drugs that ultimately, if I can control how I show up, that's the most important piece, right? I cannot control the person in front of me. But if I am aware of how I'm showing up, I can be aware of my red flags, and I can also be aware of my green flags too. And that can be really helpful in rebuilding or reestablishing relationships with loved ones who use substances.
I am very pleased to introduce our guest speaker, Andrea Kelly. Andrea is the principal for Rockwood Terrace Consultants, where she designs and collaborates with architects, developers, and private clients on mixed-use sites, parks, schools, commercial nonprofit, and affordable housing and residential design. She has been a Newton City Council member since 2018 and has worked with the chief of police in Newton to address addiction issues in the community. And most relevant for our discussion today, she is a longtime member of Al-Anon, on the board of visitors for McLean Hospital. She is married to a person in recovery from alcohol dependence and the mother of 3 grown children, one of them who has struggled with substance use disorder for several decades. So Andrea, it is all yours.
Oh, thank you. I wish I had known all of you 25 years ago. I wish I had, as many family members say, I wish I had known anything when I got into this whole issue in my family without any background. A little about me, though. I grew up in what appeared to be a functional family, and we didn't really have alcohol, much less drugs in my family. My father had the same 6-pack of beer in the refrigerator all summer long in case somebody came by and he should be able to offer a beer to someone. And then come Labor Day, 5 of the cans got thrown out. My mother was a very kind of proper hostess person who always liked to have a ½ inch of wine in her glass, but never drank it, but she needed it just to show that she was part of the party scene. So I came from not exactly a teetotaler background, but, you know, substances had very little understandable normal role in my family. Then I met my now husband, who came from a big Irish Catholic family, and they were so much more fun than my family. They dressed more casually, they laughed, they were loud. My husband and I did not realize till we were in our 40s that his parents were alcoholics and that their parents were alcoholics. He's one of 7 kids, 5 of them are alcoholics. Most of them now sober and or in recovery. So I married into this family. I've said to him many times, I'm the only one who made a choice here. You didn't pick who your parents were. I chose you and your family because they seemed so much more fun than mine. So when he started to feel guilty over, you know, his substance use, I didn't blame him. Then it should not have surprised us, but it did when 15 or so years later, our son started to struggle with substances. Drugs started with pot when he was in 8th grade. As many of you know, like early experience with substances, it tends to not be a good indicator for later. And then you combine that with the genetics. So our son got like sort of 2 of those 3 factors, and he had ADHD, which, you know, it has another role in all of this. So when he became clearly a drug addict in his late teens and early 20s, we were surprised and didn't really see the connection between alcohol and OxyContin and then, you know, cocaine and then heroin and then IV heroin. So I've been sort of led down this path through my own experience. When our son started to have encounters with the law, when his use was very heavy, our local newspaper published his name and his arrest and our name and our address in the paper. And at that time, I was like a PTO president, I was a community leader, I was a respected mom, and my husband and I said, we have 2 days until this comes out to like run to the grocery store and do all our errands, and then we'll be like hiding and in shame for the next so many years. So stigma started for us right then, the outside perception of our family. How could we have a son like that? What kind of bad parents were we? It affected our younger children. They started to hear at school about their brother. And you know, I was really sensitive to your focus on the idea of stigma. I started going to Al-Anon back before my husband got sober. I actually secretly did it without telling him what I was doing, because I thought, you know, we've talked about like reasons for communication. I was worried about the anger. I was worried about his shame. We re-upped our use of Al-Anon when our son started dabbling and then being heavily addicted to drugs. So for me, we also started with him, not with my husband. We started going to a family education and support group sponsored by McLean Hospital. A social worker, a licensed social worker, former case manager there, facilitated the meeting. And that's where we started to learn about substance use disorder. And that's also, you know, I really upped. I still go to Al-Anon 3 times a week, 25 years later. People say to me, why are you doing that? Like, your husband and your son are sober now. And, you know, I liken it to going to the gym. I can't say I used to work out. Why are my abs no longer tight? You know, the longer I got out of the practice of thinking healthy, thinking about myself, thinking about boundaries, the worse the outcome. I also then learned about the CRAFT method, which I'm going to talk a little about today, which is so much threaded throughout what Tanagra and Joe have been talking about. CRAFT is an acronym that stands for Community Reinforcement and Family Training. I first heard about it through a book. I think they have a slide they could put up, which was called How to Get Your Loved Ones Sober by Robert Myers and Brenda Wolfe. And it was a really innovative way of understanding how we can change the script, the way we dialogue and communicate with our loved ones, ideally to get them sober. Well, for us, that didn't work. For one thing, it doesn't have a direct correlation, especially for drug issues. It works better with alcohol. And then there is now training. We have friends and colleagues that we met through the McLean group who offer a series of trainings in the CRAFT method for people. And there's an updated book, which we've got the title and the cover for that to show you too, which is the CRAFT Treatment Manual for Substance Use Problems. These are really terrific resources for any of you who might be interested. The main thought of it is about how we can change the script, how we set appropriate boundaries. For me, it was about not yelling, shaming, knowing better, controlling. It was about learning actually not to have that conversation when I really wanted to, like when they were drunk or when they were high. It's not a good time. There's not a likely good solution that's going to resolve that. Just wait, be patient, pick this up another day. Let me just tell you guys all a little bit more about CRAFT. It's a scientifically proven, evidence-based approach to helping loved ones who use substances move toward a healthier lifestyle while practicing your own self-care. The main philosophy of this approach is the importance of staying involved in your loved one's life in the belief that your relationship is a powerful motivator for them to change. We've heard Joe and Tanagra talking about this. Additionally, in order to be successful on the journey of the practice, self-care is essential. We parents, we loved ones, we siblings tend to ignore our own needs while focusing primarily on the person who's using the substance. And, you know, it's like the thing on the airplane, like if you don't have the oxygen, you're not going to be able to help somebody else. The CRAFT approach introduces tools that broaden our understanding of why the loved ones may be using substances. They asked questions about that earlier. In our case, we kept looking for earlier trauma, you know, maybe a coach had abused him or something. It really, I think it was more experimental nature of a rebellious ADHD character who wanted to have fun and expand his repertoire of fun things, but who knows? So the tools are introduced on how to identify and set appropriate limits, and using natural consequences and those set by us, in the belief that the power of consequences in promoting change. Like for me, I didn't view enabling as anything but helpful behavior. But what I came to understand is that that interrupted my son's ability to experience his own consequences. And CRAFT And what you're hearing here today really helped me understand that. Craft also discusses the ways an individual can practice self-care as an important element of helping the loved one during the process of change. What we all hope might be recovery or sobriety, but it's change. And I've now met many people who have gone through the craft approach, been trained in it, and they feel so much more in control with less tension in their relationship with their loved one. They've changed their own behavior. And I'll say in our son's case, he has, in a way, credited us with sticking with him through all that slowly without judgment and shame, and being there. He did everything you hear about. He had encounters with the law. He was arrested. He totaled cars. He had overdoses, multiple hospitalizations. He did end up going to jail, which he thinks is where he finally was able to get sober. And he said when he was in jail, he realized that he had the kind of family support that no one else he met in jail had, which was in a way kind of unconditional love, which we learned through McLean's, through Al-Anon, and through Craft. So the tools for me have been like education about substance use disorder, getting support from people who have experienced it, as well as experienced people, social workers, therapists, others in Al-Anon. The revelation that boundaries are a good thing for me and my loved one, and that self-care is so important and not focusing on the addict all the time. Craft has been very helpful. Not so much, it was not necessarily a tool towards sobriety, but it really helped our communication in our family with our son. It helped remove a level of anger and hysteria and provided sort of a safe place that we could all come back to when things got better. And our son was then sober for somewhere, I'll say, between 10 and 12 years. We found out about a year ago that he had relapsed. And, you know, as awful as that always sounds, and I don't like the expression relapse is part of recovery, but it certainly is part of the whole process. The good parts of it are that he knew how to recognize it earlier. He knew how to see that, you know, he was happy he was just drinking and using pot and cocaine and Xanax, and that he wasn't using intravenous opioids anymore, and was able to get back on track, go back to AA, go back to social worker, to a psychologist, and to a psychiatrist. And we were able now to stay out of it more. A little bit of let go, a little bit of live and let live, a little bit of remembering that he's his own person and he has the right to his own recovery. So I guess I should probably stop, I think, but I'm happy to take any questions or comments through the chat or however you all want to do it. But that's kind of my story. I also want to let you know I'm still, as I mentioned, I do a lot of Al-Anon, and I also facilitate a group every week using conference-approved literature of a group of spouses of alcoholics, and I sponsor several people, and I have a sponsor. So for me, Al-Anon, I think, is also going to be a way of life to keep me stable. And my son and my husband are really glad that I got out of their business and I got out of their way and gave them the opportunity to find their own recovery. So thank you very much for inviting me here today.
Well, thank you, Andrea. And before we open it up to questions and comments, I'm going to take the sort of, I guess, the privilege of asking you a couple of questions first. One of them is sort of, did you use Craft with your husband? And then secondly, how did you have two other children, and this issue sometimes where one child kind of is front and center and the other siblings feeling like they've been ignored or pushed aside. And so I'm wondering if you could maybe also address that.
I will try and do that quickly because I bet there are a lot of other questions and for other people.
Yes.
I wish I had known about Craft when I first realized that my husband was drinking. I didn't know what the problem was back then. I actually thought maybe he was having an affair, which he wasn't, it turns out. but I didn't know about this. I was like a police officer and an investigator, and then I started sneaking to Al-Anon, and then I stopped enabling, and then I stopped judging, and I stopped being a martyr, and he found his own recovery after a year of that. So I can't say whether that would have worked with my alcoholic or not, my qualifier or not, but by the time we were starting to learn more about substance use disorder through McLean and through Al-Anon and Nar-Anon, then I discovered this book and Robert Myers and the whole concept of it. And we did institute this. As I said, it really more helped with communication and the relationship. It helped us be less judgy. You know, I learned the hard way. You already said it to everyone. Shaming and screaming and knowing better, those things didn't work. I tried each of them at least once, and it felt terrible. Like I didn't even like that person. But so having a more kind of calm, controlled, civil, and by the way, they don't like it when you change up the script, when it's different, when they're used to you being one way and enabling in a certain way, and you stop doing that. They do not enjoy that, but it's effective. In terms of my other kids, our son is the one who was, you know, doing all the substance use. He had a sister, he still has a sister who was only 1 year behind him in school, and they went to the same school. So she heard a lot from people about him. She would go out with her friends. She'd go to a soccer game. She'd have a Thanksgiving reunion, and she got a lot of it. The younger sister, her whole high school experience was impacted by having an active heroin addict brother. She has only recently this year, since the relapse, told us how shut down she became, how embarrassed she was. She never had people home because you didn't know whether he was going to be like crazy high jumping around person or calm and fun. It really affected her life. I brought my kids, all of them, to Alateen when I realized that my husband was drinking. They did not appreciate that experience. They did not like being dragged to Alateen, but they all went, so they know it exists, and they know that I've been doing this for like 25 years now. I can't say what the outcome's going to be for them. That middle daughter has a husband whose drinking bothers me, and I like that term, which Al-Anon gave me instead of alcoholic. Somebody whose drug or alcohol use bothers me. She's got a husband who drinks a lot, and I'm it's good. I can't tell her what to do, but she knows what I did, and she knows where she can go. What she can do when she figures out what's going on in her own household, if that's true. But thank you for asking that question, because it really affected, they say it's a family disease, and it is. And it also affected our other family members, the grandparents and the aunts and the uncles and the cousins, and our friendship groups, and who we stopped being friends with, either because they drank all the time or they blamed us. So I think I heard somewhere recently at an Al-Anon meeting that for each, call it maybe an alcoholic, right, 15 people are directly impacted for that one person's drinking or use. And I would say that's at least the case in our family. But thank you, Joe, for the question.
Sure. We do have another question, and again, encouraging people about Andrea's story or anything that Tanagra and I said, but how much does depression enter into the situation with your family members?
Oh, gosh, that's another good question. I think both my husband and my son would say they have depression and anxiety and ADHD, and in a way have been trying to self-medicate probably since they were about 12, each in their own different way around this. I have some difficulty with some of the prescriptions they may be taking, but in our case, depression and anxiety have been interwoven. Which comes first? Which do you solve first, and the others are still left over? They believe they each have depression and an anxiety. I'm not a doctor. I'm not going to diagnose them, but yeah, I think you hear that a lot. I've probably met at least 600 families through our McLean group, And I hear it 85% of the time that there's an overlap. You know, we might call that sometimes co-occurring disorders. You probably hear it that way. I know with really serious drug use, what is sometimes recommended is to try and get rid of the, solve the recovery part of the substance use before saying, oh, there's also schizophrenia or bipolar or whatever else in there. Because sometimes I thought my son had serious psychological problems. Like I thought he might be like a ruthless killer. And it was really it was the way the addiction presented itself was to make him seem to me like, and others, that he didn't have any morality, the lying, the stealing, the lack of remorse. That seemed like it could be pathological, but it was really addiction. So I don't have a good answer, but yes, we have experienced that in our family.
So another person, thank you, Andrea, as a professional and as a family member of loved ones who have history of substance alcohol use challenges, what was helpful to me was also to understand and educate myself on the physiological neuroscience aspects of the brain reward system and substance dependency. And I guess what I would say there is that I think having that education is really important. It also, I think in some ways, makes it less personal, I suppose, in a way, and judgmental by understanding how substances work on the brain. I don't know, Tanagra, if you have any thoughts about that.
I think we have no good drug education in this country at all. Basically, anyone, we don't have it, we don't get it. Just say no, it's not good drug education. How do we want to engage in prevention if we're not giving people the tools to understand? So I think having good drug education can help, because it can help us understand how drugs operate, how they impact the brain, why would someone be using them, and it can lead us to think about what could be the questions that we can ask from a place of respect, empathy, and love for that person to help us understand instead of judging first. So I agree with you, Joe, that drug education would be fantastic in this country and would help us avoid a lot of the pitfalls that we find ourselves facing when trying to do this work, particularly with people that we love and care about.
Another question, thank you, Tanagra. How to stop continuing to do poorly, helping men, boys to express feelings, especially in ADHD and families with other mental health history and dysfunctional behaviors. Again, Andrea, I don't know if you have a thought about that. I guess what I would say in my work, and I think because I work around anger, my caseload is actually 98% men, which is a little different from other caseloads. But for me, it's psychoeducation for individuals around that, and even sort of guiding them around sort of keeping a feeling chart about emotions that they're experiencing and feelings that they're experiencing on a day-to-day basis. To, that gets into a whole other issue about masculinity and how men are allowed or not allowed to have feelings other than anger. So doing some education around that, I think, is really important as well.
I'll just touch on that for a sec, because I was chuckled to myself when you identified yourself as like Portuguese Catholic, and there was a certain martyr piece that went in along with that background. I was like waspy Protestant, and there was a huge part of that. My husband's big Irish Catholic family, somebody asked them there, like, how did they respond? Well, they all responded by putting their heads in the sand and in denial. I mean, there was like not going to be talk about this. They weren't going to do family therapy on it. Someone asked how it affects my political life, which is pretty minimal. I talked years ago with my son about how would he feel if I was open about this. And at that time, he was sober and felt fine and said, fine. And I don't necessarily use his name a lot, but I'm the only one of 24 city councilors in Newton that talks about addiction and mental illness and harm reduction, and how can we try and move this forward, and the importance of education, which, by the way, was a huge effort on our part It was not offered. We had to like find education on this. And I know they're trying to do this in the schools. My son, for instance, who became the heroin addict, was the president of his high school Students Against Drunk Drivers. So he understood theoretically the implications of this, but he did not internalize it. So he had education. He had his parents who were open and talking. He saw his grandparents. He talked to his dad about depression and alcoholism, and he still went down that path. So sometimes it feels like it might be an easy silver bullet to just educate people and they won't become addicts or alcoholics. And I don't think there is that direct correlation, but it certainly doesn't help. And education for loved ones, for parents and siblings and other family members and friends is really important because it helps us get out of the way and helps us live a more balanced life. I'm not sure if I totally only answered the question. I was just scrolling through some of the other questions in the chat, so I think I tried to hit a couple of them all at once.
So I would just, and maybe again, Tanagra, obviously culture does play a role in sort of substance use disorder. And I think perhaps the level of stigma around sort of substance use could be impacted by a person's cultural background and religious background as well. I think we can do a broader, and that's really important in that there's maybe more of a shaming quality to it. Tanagra, did you have any thoughts?
Well, I will just add that I think it's really important to take culture into account when we're doing this work. I think that that curiosity in terms of understanding this person's background, this person's experience, the environment that they're surrounded with. For example, I live in Puerto Rico. My brother struggles with alcohol use disorder. And in Puerto Rico, you can go to a Taco Bell and you can go through the drive-through and you can leave with a margarita. So talk about drinking and not driving. You go to a Walgreens and there is alcohol everywhere. You know, birthday parties, funerals, divorces, graduations, quinceañeras. There's alcohol everywhere. So our culture has really normalized the use of alcohol as a part of a celebration of enjoying ourselves. And when you are struggling with alcohol use disorder and you want to be part of those events and part of those spaces, it's a challenge. You know, you have to have a lot of inner strength to be in a space where you're going to be bombarded. So changing people, places, and things in this context is not helpful, right? We have to look at because it's part of who we are, right? It's in there. So how do we then support the person to be able to set the boundaries, to be able to gain the strength internally, to feel that they have the support and the resources that they need to continue to be in relationship with family and friends and family members, and also know that there will be alcohol around them in this case, for example.
Andrea, another question here. What was most helpful to you in being able to connect and feel supported with professionals you sought support from? I guess I would add to that question more, where there's any encounter with professionals who you thought, oh my God, this is not helpful. So.
Let me unmute. Oh, again, great questions. When my husband and I, before I understood what was going on and I thought something was wrong and I didn't know what it was, and we went to a marriage counselor. I think we maybe went to 2 different couples counselors. Neither of them had experience specifically with addiction. So when we would go in, he seemed like the calm, soft-spoken, khaki-panted one, and I seemed like the crazy, hysterical crime wife. And I was somehow the bad guy. So advice I give people all the time now is if you know you're dealing with some kind of an addiction issue and you're going to go to a counselor, make sure they have training in addiction. When we were learning a lot through McLean's, several of us, including some of the people who teach craft now, would meet with incoming medical students, residents, interns, and talk with them about addiction and our experience. And without fail, and I talked to a group of nurses once at Mass General Hospital about this, and they came up to me afterwards and said, you just don't look like the mother of a heroin addict. You seem so nice and normal. And so there's that stereotype, you know, who this affects. So I would say find a therapist, a counselor, a social worker with training in addiction, because it really helped. And I just lost my train of thought. The other thing about the answer to the question directly is when our son was first doing residential detox, which I did not understand, didn't mean the solution to everything. I thought they were going to get him sober in 10 days at McLean's. I'm like, yay, thank God, we figured out what's going on. There was a case manager there on that unit at McLean's, and they offered this family education support group to all family members who had inpatient people in any of the addiction units at McLean's. And we went to that. That's where I've met 600 people. That's where we've been going for 15 years. That social worker, who's no longer affiliated with McLean's, now like Joe is in private practice, recommended my name to Joe. We then went to him for family counseling. We brought our kids to him. I recommend him and others like him to many people I meet through Al-Anon almost every week. So finding one person who was helpful and connected and understood the value of education and support that's probably the pivotal point for us in our own family recovery. And sadly, you know, it's not the end of the line. Like, as this recent relapse showed us, things aren't going to stay the same forever. But now I know what to do. And that one person really made a huge difference in our lives. And I hope everyone can find a 1%. That what I've learned too is, like, not to talk about this stuff with the well-meaning friends who tell you to, like, leave your husband or kick your kid out, or very well-meaning comments. But I really pretty much now just talk to people I meet through Al-Anon or Nar-Anon or the McLean's group or others who understand what addiction and substance use is all about. I don't get a lot of support. I get a lot of misguided, well-meaning, unsolicited advice from other people who aren't part of this field. And so that's another good thing that's happened to me. I got out of the unsolicited advice business. I was really good at it. I thought I was very helpful. And through my son's experience, I've learned to just not do that. Hold my tongue. I don't know best. I'm not the answer. Focus on myself. Let him find his own recovery. Be here to support, to listen, to not judge. Unsolicited advice, not helpful.
Just in the chat, there is a tremendous group called Second Act that brings drama therapy to the community to develop awareness about stigma, which is really one of the major roadblocks. And I think a very important question here, say more about the focus on harm reduction. And so, yeah, I think it's important to, you know, obviously in Andrea's son's case, recovery was his choice, but that isn't necessarily the choice of other people. And so being able to help families hold that and to also educate them around what harm reduction means, and it may not mean abstinence for that person. And so helping them understand that, I think, is really important. But also helping them appreciate what can still occur for the person and how to help them, even if they haven't decided or if they just don't want to stop their use of the substance. Tanagra, I don't know if you have thoughts there as well.
I think harm reduction is an excellent tool to build relationships with people, to build honest, truthful relationships, to help establish healthy boundaries with folks. It is a way for us to actively listen to the other human being in front of us, to also check ourselves in terms of when we are showing up from a place that we think is helpful and it's not. Because it's asking us to really relinquish, again, that role of expert, right? We think we know it all. And it's like, and I'm like sitting in my moral high horse, and substance use is not a moral failing, right? And we, a lot of the times in this society, make people who use drugs look like they are evil, bad people that don't deserve to live. And that is really, really harmful, and that's stigma. And I think harm reduction gives us the opportunity to rethink the way that we are in relationship with others, as a way to really think about the way that we're in relationship with self, right? And I see Celeste sharing in the chat box that They have worked with many professionals who were using medication for opioid use disorder, right? Like that is part of harm reduction, MAT access, if that's what the person wants, and giving the person the choice to decide which ones work best for them too. There's a lot of judgment around MAT, right? That says, oh, you're still not clean, you're still using a substance. Well, if that person has a better quality of life, they feel healthier and safer and better. Would we take insulin away from someone who's diabetic? Would we take heart medication away from someone who is a person who has high cholesterol and blame them for their disease? No, we don't do that. This is the only disease where we punish the person for not only having the disease, but also for looking or searching for medication to make it better.
Oh, Tanagra, I'm so glad you mentioned that because I saw that message in the chat too. And I was going to say, I forgot to say that our son did try Suboxone in different ways, mostly misusing, abusing ways. He tried methadone. I think for many people, and I've heard from many, that those mats are very helpful. But there is a lot of stigma around it and abuse options too. The other things that I've been involved with in terms of harm reduction are is Narcan. That's a tool of harm reduction. Fentanyl test strips. These are things that EMTs and police departments and communities can provide that certainly harm reduction. So there are substances that count in towards harm reduction too. That some of those things did not work for us, but I wouldn't say they're not very helpful and effective for other people.
So just young people are not educated about safe use procedures. Rhode Island has a safe use clinic that was set up several months ago. Are there also in Massachusetts? I think somebody responded, not yet, although there are a couple. I think Somerville and a couple of other communities are looking at opening up safe use. Andrea, can I do want to find a follow-up on your political role as a city council person. I'm sorry, but how do you, as you sort of work in that field, how do your fellow council members respond to your advocacy? Because you've done some of that. Are they accepting? Are they like, okay, this doesn't happen here, or it doesn't happen that much? I'm just curious about that.
I hear that all the time. Doesn't happen in Newton. Doesn't happen here. Doesn't happen to people like us or who look like you. Most of them, for instance, I had to get off some earlier meetings to say, oh, I'm going to be part of a webinar around, how families have been affected by addiction. And that just shut everybody right up. Nobody followed up. No one said, oh, really? What's that about? What's your experience? It was a conversation stopper. A few other people, I get calls from some of my colleagues about someone in their firm who seems to be having a problem with alcohol. How would I handle that? Where should they go? I get like behind the scenes calls for kind of referrals or advice, but it's not a very public thing here yet. It's not still an acceptable topic. On my website, my campaign website, on my campaign business cards, I put addiction and mental illness as one of my top priorities. And it hasn't stopped me. At one point, I was the highest vote getter in Newton. No, I fell off a little bit last time because of housing, some of my pro-housing stances, but I don't think it has negatively impacted, but I don't stand on a soapbox and talk about my story there. I do speak, as I said, to nurses and residents and at Al-Anon meetings and sponsor people, I'm very open about that. I don't think it has affected my political career, which frankly, I don't actually feel like a politician. I feel like I'm elected to a community service position. And one of my messages has to be around addiction and mental health issues.
Thank you. I know we've had some back and forth in the chat around resources. I won't read those, but Tanagra?
interested in accessing naloxone, it is over the counter now, and you can purchase it at CVS or any other pharmacy that carries it. Also, you don't have to pay for it if you're connected to your local harm reduction program and you want to get a kit. They would be more than happy to train you and offer you a kit. Also, depending on the state that you're in, I know we have folks from Rhode Island and Massachusetts. Your local health department also has access to naloxone, and you may be able to get it through them if you're interested. If you don't know where your local harm reduction program is, National Harm Reduction Coalition has a nifty tool called the Naloxone Finder. You can go there, you can look up your state, and all of the programs in your state that offer naloxone are there. So you can click and get the information. You're in Fall River. I have seen some folks are in Fall River. So yeah, so you can go there and you can see which is the program closest to your community or in your community where you can access naloxone.
Hey, Tanagra, can you address this? I had heard here, we had a couple of pharmacies in Newton that were able to give out naloxone, Suboxone, but I've recently heard that they're no longer doing that because they don't get reimbursed to even cover their expenses for it. Is that something you've heard?
I am not aware of that. But in terms of the naloxone, because Suboxone is a medication, right? But in terms of naloxone, now it's over the counter, so you can just go ahead and grab it and buy it. In terms of Suboxone,
Very expensive though. It's very expensive, I've heard.
Yes. I mean, let me just, okay, I could go down a rabbit hole around pharma patients and all of that stuff. All of that is to say that we know that in this country, health is not a human right. Health is for profit, and pharma has found a way to make a lot of money out of this crisis, particularly around naloxone, making it more difficult to access. So I would say connect to your local harm reduction program. They can provide you with naloxone fentanyl test strips, particularly if you're a loved one or a family member of a person who uses drugs. They'd be more than happy to provide you with those resources. If not, you can write to me and I'm happy to connect you. You'll have my email.
Our local health department has done training and how to use it and passing it out so people can try and reach if they in their town or city, if they have a health department, that might be a good resource too, rather than the drugstore that charges too much.
So we're almost out of time here. I want to thank Andrea Kelly for sharing her story and information. It really sort of, I think, helped kind of put a lot of what Tanagra and I said in perspective.
Thank you, Andrea, so much for your candor and for sharing yourself and your story.
Great series. I hope that your next two episodes are successful also. Thank you all very much. And thanks for all the attendees. I so admire social workers and who want to learn more about this field.